Corneal transplants are such an important issue in health. You know, so many patients are in need of a corneal transplant, but there are so many hindrances. And so today we will be talking about this in such great depth. To help me with this, I've got Dr. Bongi Mofokeng. She's a qualified ophthalmologist working at Charlotte Maxeke Johannesburg Academic Hospital. She has a special interest in cornea as well as pediatric ophthalmology. So this is the Dr. Tev Show, where we're putting your health back into your hands. Hi, Dr. Mofokeng, how are you?
I'm good, Dr. Tibbs. How are you?
I'm good, thank you. So I know that this is a very special topic for you because you're so that's interested. You love cornea, you know?
I do.
So first and foremost, I'm sure people are just like, what is the cornea? Because now that we're talking about organ transplants and so forth. So just to help everybody understand, which part of the eye are we talking about? Is this the whole eyeball or is this, which part of it is it?
So Dr. Tibbs, yeah, the cornea is at the front of your eye.
Okay.
So we don't see it. You know, when we look at each other, we don't see it. But it's actually the clear window that sits over the iris and the pupil. The iris is the brown or the blue. You know when you say someone has blue eyes, brown eyes, green eyes. That structure is covered by a clear covering. We call that the cornea. It's the most sensitive structure in the body. And it's clear, it's transparent because it has to transmit light. It has to bend light and help you form a nice crisp image. So yeah, that's the cornea. It's right at the front of the eye. That's why I personally love it, because if you fix it, a lot of times you can fix a lot of problems. A lot of times.
No, that's very true. That's very, very true. So now when we're talking about corneal transplant, because we know we can't transplant the whole eye.
Yes.
We are not there yet in science.
At
We
this
have not
moment, no.
no, maybe in future, but today not. So can you explain who normally needs a corneal transplant? Which patients need this?
Yeah, so a lot of patients normally need, from children to adults, right? People who are born with what we call corneal dystrophy. So that's a condition that where a patient is born and the cornea has a problem. Because it has a lot of layers, you know, the cornea has about 6 layers, it has a lot of layers. Any of those layers can have a dystrophy. Dystrophy just means it didn't develop properly. And this is from genes that were inherited. And so the person will be born with the cornea not clear and transparent, but it'll be cloudy or white. And obviously they can't see through that. If you think about a dirty window or a cloudy window that's not clean, think about your windscreen in your car when you're driving. The cornea is like that. You know, you can see the person inside, but there's a covering in the front that helps the person see outside, and it protects the inside of the eye. That's what the cornea, like, briefly and simply is like. So people who have corneal dystrophies, people sometimes who have corneal infections can need a transplant, because when there's an infection in the cornea or inflammation for any reason, it leaves a scar. And the last thing you want is a cornea that has a scar or anything white. It should be clear. That's why it doesn't even have blood vessels.
Yeah.
You know, it should be clear. So people who have keratoconus, like we spoke about, so people who have that condition, children, like I said, who are born with dystrophies, but also sometimes people who have very bad glaucoma, you know, because glaucoma causes high pressure in the eye. Sometimes the cornea can become filled with fluid because there's just so much pressure wanting to come out, makes the cornea hazy. Over a long period of time, that can be a problem. You know, people who have scars on their cornea for any reason, whether it was trauma or chemicals. If something was thrown in someone's face or their eyes, or they get a chemical injury or a burn injury, the cornea is no longer clear. They may need a transplant. So anything that causes the cornea not to be clear, obstructing vision, can warrant a transplant.
Okay.
Yeah.
So can you tell us, you know, just in general, how do you do a cornea transplant? Is it a thing where, you know, you are switching them, or let's just explain briefly, because then people at home are like, they do corneal transplants. How do they do this? You know, where do they do it? Is it in any hospital, in any clinic? Is it in only special places? Can you just elaborate so that people understand more into this world of corneal transplants?
So actually, it's the most commonly done transplant in the entire body.
Wow.
The reason for this is because, like I said to you, it doesn't have blood vessels. So the risk of the person receiving the transplant rejecting it.
Explain rejecting.
Okay, so you know, when we say transplant, we're taking someone else's organ and we're putting it in another person's organ, whether it's a heart or a kidney or a cornea. But now, one thing that is normally a problem is that this person's immune system, say I'm receiving the cornea from someone else, my immune system recognizes this as a foreign thing.
So when you say immune system, you mean the soldiers in the body that fight the infections.
Yes, my soldiers see this as an invader or an intruder, and they want to fight it away. Like, no, we don't want you here. But we don't want that because this person needs that. If the soldiers fight it off, they can destroy that thing. Because our soldiers can be very strong, you know, and they can destroy that thing and making the transplant like useless, basically.
Yes.
So yeah.
So that's what rejection is.
That is what rejection
Okay,
is.
so you were saying that this is the most common organ, basically.
So it's the most common one done. And you were asking me, how is it done?
Yes.
Where is it done?
Yes.
So transplants are done worldwide, but in South Africa, let's zoom down.
Yeah.
It's done in private hospitals. It's done by both people who specialize in cornea. So ophthalmologists are the ones who do it. So we get ophthalmologists who specifically specialize in cornea, but also other ophthalmologists who are not specifically specializing in cornea also do it. Because it's, like I said, it's a procedure that's done a lot and it can save sight, right? So in the government sector, it's also done. You know, big hospitals like Grooteskier or Joburg or Steve Biko or Kalafong. So if you are in the public sector and you maybe have a scar or you had something wrong with your cornea, an infection in your cornea, or born with a condition of your cornea, you can go to a government hospital. They'll always refer you to tertiary. If in private, you can go to an ophthalmologist.
Sure.
Either they'll be the ones doing it or they can refer you to someone who is doing it, you know. And then you asked me, how is it done?
Yes, practically.
Yeah, so practically the cornea is harvested.
Yeah.
Harvested means taken from.
So you take it from the person who has died.
The person who has died.
Okay.
So the person who died would have donated while they were alive.
Yes.
They would have said, okay, when this person dies, they want to give their cornea and heart and whatever.
So they give a permission.
They give permission.
To say when they pass away, they want to donate their organs. So not just the cornea, it's the hearts, the kidneys, whatever is healthy and can be given. Then they give it.
Yes, and because a lot of times people die from things that affect the other bigger organs like the heart or the kidneys or the eyes, a lot of times are spared.
Yes,
you know,
because they're saved from
they're
that.
Like protected, you know. So people will donate their corneas, which is awesome. Us in South Africa, a lot of times, most of the donors, the people giving permission for their organs to be taken and given to someone else, are from outside. So from the US, you know. Most of them are from out of the country. Unfortunately, a lot of our South Africans do not give permission for their organs to be taken and given to someone else.
No, we're gonna come back to that. We have to dive into that because I think there's a lot of underlying reasons, but we're gonna come back to that.
Yeah.
So you were saying in terms of the practical.
Yeah. So now they take it, they'll transport it, fly it into South Africa. And then we, at our clinic, specifically at Joburg, there's a waiting list. And like in other hospitals, there'll be a waiting list of people waiting for transplants because we don't know when it's going to come in. You don't know when the donor passes away or when it arrives. Then we get a call, the cornea comes in. We call the patient to come in as soon as possible because that transplant needs to be used within a certain amount of time. The patient comes in. They go to theater.
Okay.
So the procedure can be done with the patient who's receiving now. Either they can be sleeping out in theater if they want, or it can be done with just injecting around the eye so they don't feel any pain.
So you numb the eye with an injection.
Yes, we numb the eye. Then what we do is that then we'll measure how much of the person receiving the cornea, how much of their cornea we must take out, and then we measure how much of the donor must then be put in.
Okay.
And then we'll stitch it.
Okay.
Right? So there's the stitching one. That's the one that's done a lot. We call it penetrating keratoplasty.
Yeah.
That's done to all the layers.
So that's like the full cake. So it's like taking the one cake out and putting it in.
Yes, the full cornea with all its layers onto someone else. But now, because technology has advanced, we also have procedures where you can take bits of the cake. So depending, depending on the person who's receiving the cornea, where their disease or problem is, maybe it's in the innermost layers, then we only take the innermost layers from the person donating and we put it in. If it's the middle layer, then we only take the middle layer and we put it in. If it's the top part of the cake, we remove the top part here, we put it this side.
So you can literally do like a layer transplant, a lamella, that's what you use.
Yes, lamella transplant, where you replace the layers as needed. The nice thing about that surgery is a lot of times, especially with the inner layers, you don't need to stitch. The stitching means now we need to follow the patient up and remove the stitches slowly so it's long. Whereas if you don't stitch, the patient can just, continue with life. Yeah, so depending on the layer that's affected, you can replace whatever layer that is.
And it sounds like with the layered one, you could use it for multiple people.
Yes, that's the other nice thing. Like you can use one for a lot of people and sort of split the layers. Yeah, that's also the nice thing. And also, the other nice thing is the rejection rate becomes less because you're not taking a huge chunk and putting it, you're just taking what you need. Sometimes you take what you need, use it for multiple people, and you still have a lot left to use on someone maybe who has a hole in their cornea, from whatever reason, and you can use that little bit. So it's even more economical.
So what has your experience, tell us a little bit about your experience with helping patients who needed corneal transplant. Did it really make a difference in their lives? Did it change their lives, from someone with a big scar, couldn't see with that eye, and then you put in and boom. Have you seen those sort of things? Does it really make a difference?
It does. I think even in my training, I've seen a lot of people, you see them waiting, and sometimes one day they get called, they come in. Sometimes it's a young person, it's a teenager who needs that, especially the keratoconus patients who really need a lamella transplant. They come in and they get it. Their life is just changed because now all of a sudden they can see, it's like there's a clear glass, there's no more this blurry image, it's clear. Or it's an older patient who's maybe 60. And they've had cataract surgery. From the cataract surgery, maybe they had issues, and then the cornea also got damaged for whatever reason. Maybe they had glaucoma after that, or the cornea was just too thick after the cataract surgery. We call that pseudophakic bullous keratopathy. And then all of a sudden, they just get a cornea.
Wow.
And it's like, it's clear. It's not like I'm looking through. Have you ever driven with a dirty windscreen?
It's the worst.
Or when it's raining and you just like, can I just clear, You
even drive slower because the rain is just pouring.
Now,
you can't
imagine
see.
someone living like that. Imagine someone living with that image. Like you said, you drive slower, they move slower, they ride slower, they're very cautious, because they can't see through that. But now all of a sudden, someone decided while they were living, they'll donate. They donated, and instead of their cornea going to waste when they're getting buried, it's helping someone else. Sometimes it's a young person, sometimes it's an old person. The quality of life, the patient's face, the family, everyone is like, oh my gosh, this person's like a new person. Just because one person decided, I'm going to let someone use my organs when I'm gone.
So having reflected on, the difference, corneal grafts make in a person's life, why do you think that in South Africa we have such a shortage of corneas or corneal donors or organ donors, rather, let me put it that way? Why do you think this is such a big problem in our society, and how do you think we can, get people to be more open-minded about organ donation and corneal donations?
Thanks, Dr. Taves. That's such an important question. I think the biggest thing is people just don't know. They don't understand. Especially in the culture of South Africans, people feel like, I don't want people to take my organs out. I want to go to the grave whole. There's that sort of mindset. Sometimes people feel like, it's disrespectful to the human body if we're going to bury a loved one without their cornea or something cut, or whatever the case may be, or the heart taken out or the kidneys taken out. They feel like, it's not you, it's disrespecting the dead. But I think if we educate ourselves, I must be honest, I'll use myself as an example. Before I did medicine and before I did ophthalmology, but specifically medicine, I didn't understand the concept of transplants as well. I felt like, no, I don't want to donate my organs. I want to go, everything must just go,
Yes,
complete. I'll be in heaven, it must stay as it is. But understanding what someone's kidney, who's no longer on the face of the earth, can do for another person, it's amazing. Literally saving another life. Even though one life has now gone, you're actually saving another life. You're providing life to someone else. I'll talk about the cornea because that's what I'm into. Giving someone else the chance to have sight. That is huge. Some people have been laid off work. They can't work. They can't take care of their kids. They can't go to the toilet alone because they can't see. The family feels burdened, and there is no medical solution.
Yes.
There are no drops that can take that problem away. The only way is for someone to donate a cornea. So if you look at it like that, if you see the bigger picture, it's not about us burying one person, but saving, and now with a cornea transplant, you might be saving 3 people at the same time.
Exactly.
3 people at the same time are going to see because you decided to donate. So instead of us waiting on the US or the UK to help our Africans, imagine that, Dr. Tibbs. People in the UK must die and donate to Africa. What is Africa doing for Africa, though?
Sure.
If you think about it like that. So it takes someone from the US to be selfless and help us, but we can help one another. We really, really can. And we have some of the best, and when I say best, I mean the best in the world doctors in South Africa. The best.
I love
Whether
that.
they're ophthalmologists, cardiologists, whether they're nephrologists, or whether they do liver transplants, gastros, the best. And really, if we have the skill and we have people in need and we have people who can donate, why not? Why not donate and help another life? Give a life for a life that has gone. Isn't that amazing?
That is amazing.
Yeah.
That is amazing.
Really, that is my take. And I'm not just saying this, I'm saying it because I also had a mind shift, because I saw the bigger picture. Yeah.
Sure. I love that. What is Africa doing for Africa?
Yeah. What are we doing? It's time for us not to look to the West all the time when we have the resources. We have great doctors, we have the skills, we have the technology. We can really do this.
I think that we are closed-minded until we ourselves or a close relative or loved one needs a transplant. Until you hear that, this person needs a liver, or this person needs a cornea. This person's, all of a sudden you start realizing that, man, organ donation is so important. It is vital,
so important.
because it's just this one organ that's needed. And it changes, as you say, with a cornea, it changes the life of a human being.
It changes them, it changes the human being's life, it changes the family, it changes the economy. All of a sudden, you have someone contributing to society because they can see.
Yes.
You know, it changes everything. All organs, I truly believe, it changes lives. And this is not a cliche. Like you're saying, you don't have to wait to be in the shoes where there's now a need. We need a liver transplant. We need a cornea transplant. Like, someone help. You know, the desperate situation when someone can provide the solution, because we can't manufacture organs.
No, we
can't.
cannot. No,
As
we
doctors,
cannot.
we can't manufacture them. So there's a reason why, you know, this transplanting of organs, it's not, if you see it as, it's not a waste, it's not a disrespect, it's actually helping someone else live,
Sure.
helping another family. Yeah. And that is priceless. That is absolutely priceless. Yeah.
To give someone the gift of life.
Yes.
You know.
Yeah.
And so I think a lot of people think, you know, it's good that I've respected my relative or whoever who's passed away by burying them, you know, with their organs and everything. But then would it not be even a more beautiful gift to think that, you know, once my auntie, whoever passed away, we were able to help 7 other lives to continue living.
Yes, from her one life.
Yes, she's
help
giving life to these 7 or even 10 with the corneal grafts. You add those 3, it could be 10 people. So, you know, there is so much more gift at the point of your sorrow. You know, you can give a gift of hope, of life, of joy, of celebration at the time of your sorrow.
Yes.
You know, so I think a lot of our viewers back home, we all have to reflect and think to say, you know, I should consider this to help other people.
Definitely.
So yes, I think in the description below we'll definitely put, you know, information about where to sign up to be an organ donor.
To be an organ donor.
Because there are these places, there is this place where you can sign up and you can write and say, I want to be an organ donor. And I think it's something that's very important that we should all consider and, you know, do.
Yeah, no, definitely. And it should start with us in South Africa. Really, South Africa is a very advanced country. And I don't see why we can't. I don't see why not. Like I said to you, I think the solution is right here with us. So if we as South Africans take it upon ourselves and not wait, you know, sometimes we have patients come to the cornea clinic and they're like, we're still waiting, you know, I'm still on the list, I'm still waiting. It's been 3 years, I've been waiting since COVID. And we're just like, well, we're also still waiting, you know. Obviously, people in the US also need those corneas. They're not just sending to us because they don't need, they're sending because they're helping us. But we can help one another here. We can.
Sure. So on that note, what are your parting thoughts to our viewers about corneal transplants?
So my parting thoughts are that, so look at the information below and really consider it. It's not anything bad. It's actually you are helping someone else get life. You're helping someone else continue living. Even when you've left the face of the earth, someone else can keep living. And appealing to families, you know, it's not like a disrespectful thing. It's actually a helpful thing. Consider donating. The other thing is that if you have corneal issues, don't wait at home, you know. Ask for help. There are clinics, there are private clinics, there are optometrists. You can go to them, they'll refer you to an ophthalmologist if you need to be referred. Having someone else's cornea in your eye is also not a taboo thing. It's actually, it can help you, you know. And I mean, a lot has been done on corneal transplants. The technology is advanced. It can really change your life. So don't be afraid also to get one or to give one.
Yes, don't be afraid.
Yeah.
Yeah. No, thank you so much, Dr. Mofokeng, for, you know, joining me on this very important topic. Thank you so much.
Thank you.
And thank you so much to you viewers today for joining me on this wonderful episode. I mean, I think this is one of the most heartfelt and heart-wrenching episodes that we've ever had. And so please do consider becoming an organ donor. We'll leave those contact details or those information details in the description box below. And if you have any more comments or questions about this topic, please leave them in the comments and we will get back to you about them. And yeah, and don't forget to like, share and subscribe and push the notification button so you know when we post our next episode. And yeah, please follow us on our Facebook and Instagram pages on the Dr. Tibbs Show. So until next time, please do take care of yourself, take care of each other, and remember, your health is in your hands. God bless.